Hey, look at that.
Is it supposed to glow red for the mute?
It's supposed to go red if the mute is off.
Okay, perfect.
Hello, and welcome to another Chat with the Docs. I am Mo, the Docs, and hey, we even have volume.
There we go. And I'm Dr. Noel.
We are the practitioners at the Siloam Center for Traditional Medicine, Traditional and Integrative Medicine in Janesville, Wisconsin. And this is our weekly webcast. And we will be answering your questions, taking your questions and answering them towards the end. But we have a... What would you call this? Would you call this a show? Would you call this a spectacle? Would you call this a learning experience? Would you call this a petri dish of an experience? I don't know.
All the above.
Okay.
All the above. I like the learning experience.
We have a learning experience for you today.
We thought we would talk about the allergies and some things that you can be doing because this is allergy season, and according to Wonderground.com, is that the Weather Channel? Is that what they call themselves
We'll
now?
go for
that. According to the Weather Channel, you know, the guys in the tight little jeans that get up there and show you pictures of panda bears and tornadoes. I'm a little sarcastic.
The pollen count's high, right?
The pollen count is high. The pollen count is extremely high, and people are starting to have some real problems with it. And with all that's going on with the COVID-19, you know, people whip up that their sinuses are full, and you know they might have a sore throat, they might be feeling really schleppy, but it's not a virus.
No.
It's allergies 9 times out of 10. I mean, we've been in social isolation for a month. Odds are, if you're feeling lousy, it's probably
Allergies.
the allergies. So we were going to talk about some of the things that you can do, some supplements that you can get. Keep in mind any of the supplements that we show you, any of the herbs that we show you. All you have to do is get a hold of us, info@siloamcenter.com, and we will make sure that we get you an email link that you can purchase these things at. So Dr. Noel, I'm going to let you introduce the natural D-Hist.
Okay.
Because I know you love it so very, very much.
This one is through Orthomolecular. It's a good brand that we both love to use. We told you about some of the vitamin D3, B vitamins, other stuff in the past. We use Orthomolecular for that one. The D-Hist helps with the allergies for natural way instead of going for the Benadryl or the Claritin or anything like that. You can use this one. So this one, the biggest ingredient in it is vitamin C. That's the main. And then some other secret ingredients that is worth it for getting this. But this one we have at the clinic that you can get. And I've been actually really good this year. And I'll tell you why a little bit later as we get into this. I haven't even had to take this yet because Mo fixed me up over a year ago. But
now,
yeah.
Does that have bromelain in it?
This one,
I think it does.
yes, it does. 100 milligrams.
So if you are somebody that has an allergy or a sensitivity to pineapple, I'm sorry, the natural D-Hist ain't for you.
And it says pineapple right on it too. There's also stinging nettle. And then another cysteine.
Now, what's so cool about the D-Hist is it's not something that you're limited to just using prophylactically. You know, taking. I usually tell my patients take three times a day, and if they're even more sensitive, take 6 3 times a day.
The loading dose.
The loading dose. But if you are having an allergy attack, taking 3 of them isn't going to probably do too much in the short term. So what you do is you take 1 capsule every 15 minutes until you start seeing those symptoms decline, at which point then you can go back to your normal dosage.
Yep.
Now, people who are not familiar with herbs and supplements will usually listen to some of the high dosages on the dehisced or Chinese herbs, and they'll say, "Isn't that a lot of pills to be taking, Dr. Noel?"
Not when we're depleted.
No, it's not. Because when you're dealing with herbs, and I'm going to throw the dehisced in the same category as the herbs, because you're dealing with the nettle leaves. You've got 400 milligrams of nettle leaves, 100 milligrams of the bromelain from the pineapple. Yeah, you got the quercetin in there, the quercetin dihydrate. You've got the vitamin C. But the stinging nettles, in order to get the nettles in here, and you open this up and they're green capsules from what? The nettles. In order to get those nettles, they dry them up, they powder them, and in order to get 400 grams into one, and a therapeutic dose is going to be somewhere between 800 and 1200 milligrams of nettle, you got to take several of them.
That helps with the liver, correct?
That helps with the liver. That helps with the interaction between the liver and the lung. But the point being, if you're going to be taking something that's clean and natural and is nothing more than an organic or wild-crafted or clean source of, let's just say, a leaf, in this case, nettle leaves, and then it's dried up and then ground up, powdered, you're going to have to take a number of capsules to get that therapeutic dose. It's just, unfortunately, the way it is. Now, the natural dehisced comes in 120 capsules. I don't remember what the cost is on that. Do you remember?
I want to say, is it maybe around 30?
It's
Maybe around
between
that.
30 and 40.
See if
But
I
if
can-
you get a hold of us at info@silomcenter.com, we will build you a profile at wellevate.me, and that will allow you to get a 10% off ongoing on your dehisced. Help you save a little coin that way. Now, if you don't want to be giving the natural dehisced to your munchkins, your kids don't necessarily need those higher dosages. We do have the dehisced Junior available for kids, and it works very, very well.
Let's see.
If you have any questions about the price of it, you can go ahead and email us. We'll
Maybe
figure
not
that out
even
for
that
you.
much. From my other place that I work, that's about what they have it at. That seemed, I don't know if that's right on or if that's a little low compared to,
The dehisced Junior, I think that's about right. It's going to be
Okay.
between 15 and 20.
okay.
Dehisced Junior's 15 to 20. Natural dehisced for us geezers, everyone over the age of 8. You're going to probably be looking at about 30 or 40. Something else that you can be doing, and it works really well if you'd have started it back in November,
Mhm.
is, you always hear people say, I eat local honey because it's going to help me with my allergies. Well, it's not the honey per se that's going to be helping you with your allergies. It's the trace amounts of bee pollen that's in there. And the bee pollen is from
The area.
the local area. So a lot of folks will be eating raw bee pollen. And if you look at it, I don't know if you can see that or not. If you look at it, it kind of looks like little golden nuggets of grape nuts or something like that. But these little granules here take 72 minutes each for a bee to make.
Collect. Okay.
And the bee will make it because she's flying through the air and she's building up a static electric charge on her body, up to 400 volts of static electricity. Wow. That's a lot.
Yeah.
And then she goes and she lands on the flower, and the flower pollen has a slight opposite charge. So it's when it gets on her, it stays on her. And so you'll see the neat little National Geographic pictures of
Those legs that are full.
the legs that are full and the bee covered with pollen, and they're beautiful. And then she has on her front paws, she's got little built-in combs. She'll lick them and get them wet with her saliva and start combing through her hairs and packing it into those cargo pants. But as she gets that saliva on those pollen grains and starts packing them together, that saliva starts breaking down the pollen. So instead of just having straight pollen, you now have the chemical reaction of those enzymes in the bee's saliva breaking it down.
Okay.
In ancient China, they used to make very fine nets out of silk. And they used to, when the pollen would be over the lakes and ponds, they used to seine the pollen off the top of the lakes and ponds, dry it out, and give it to the emperor. And pollen is incredibly good, and it essentially inoculates you to your seasonal allergies. But in order to really get a good effect, you want to start eating it regularly a good 6 months ahead of time.
That's that kind of loading dose, I guess, as you would say, for
Yeah.
the natural. Cool.
Yeah. And then you're going to want to take at minimum a tablespoon a day.
Okay.
Now, what happens if you're having an allergy attack and your sinuses are full? Well, one of the things you can do, we have evergreen herbs. They have something called Puaria clear sinus, or herbal AVR, or Lonicera complex. The Puaria clear sinus is very good because what it does is it takes the inflammation out of the mucal membranes. And that takes up those mucal membranes. Once they start to swell, they take up space in the sinuses.
Then nothing can drain
and
either.
nothing can drain. And so then that Puaria clear sinus goes in, causes those mucal membranes to shrink up a little bit. Things start to drain and clear out. It's also got some antibacterial properties.
Awesome.
So it starts killing any potential sinus infections that are started due to the allergies.
Mhm.
The herbal AVR has some similar actions. However, that is more antiviral, which is really great when you're in flu season.
Mhm.
Kind of hard to get right now, but we do have some available. Another really good one is something called Lonicera complex, again from evergreen herbs. And you don't have to stick with evergreen herbs. I do because I trust their purity. I don't like a lot of the Chinese herbs that are out there because the herbs for those formulas come straight from mainland China, and I don't trust mainland China's for anything
Process.
that has to do with cleanliness. Their herbs can be pretty dirty, and so I'm very meticulous about the sourcing.
That's good. That's a good thing.
So one of the other things that we have available, and I'm sure you see this lovely little jar.
I love that jar.
Isn't that pretty? This is something that I use for my NAET. NAET stands for Nambudripod's Allergy Elimination Technique. And no one wants to say that, so we just say NAET.
Mhm.
And you think that we're intelligent. And but what NAET is, it's nothing magical or mystical. A lot of folks have out of a desire to explained it as something very mystical. Ooh, it's energy. What you've done is you've got water in a little glass vial. And water is an incredible molecule that allows you to change the frequency at which it vibrates. You can actually tune the water in this little vial so that the molecules vibrate at a different natural frequency than what water normally would vibrate at. So what we do is we use some electronics and we tune this water to vibrate at a harmonic of frequencies of the different pollens in the air right now. So then what we do is we take this vial and we have you hold on to it, and we use muscle testing. And everyone says, oh, that muscle testing is bogus. Well, I can do blind muscle testing on a patient and get the same exact results as their blood work.
Mhm.
It's
He's done it with
uncanny.
me. It's almost unbelievable, like how your body, well, it's not unbelievable. We know the body's intelligent, but actually when you're experiencing it and the body's responding.
But what is this
Yeah.
measuring? Your body is picking up, your cells act as little antenna, and they're picking up on the natural frequency of what's in my hand.
Mhm.
So then, when we isolate a muscle and we do that muscle testing, what are we checking? We're checking your body's fight or flight response to this here. So if you have an allergy there, you're going to have a fight or flight response, and your muscles are going to go weak. They're going to go, oh.
Mhm.
And so you're not going to be able to hold it up.
Resist it.
So then what do? I use this really fancy gun that goes dunk, 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 up and down the spine. And I am stimulating the sympathetic nervous system's nerve roots in doing so, while having you go through different breathing techniques. And maybe next week we'll
We'll
do
get into it more.
An example of it. But in doing so, we're physically shutting off your body's fight or flight response to what we have tested you for and what we're treating you for, in this case, the various pollens that are out there. And in the end, after we do the treatment, depending on how sensitive you are and how well you took to treatment, we can do that test again and you won't be weak.
Mhm.
And then we stimulate some acupuncture points with usually a laser and some vibration. And that locks that treatment in place. And in your case,
Over a year.
over a year.
Yep.
Sometimes you have to do tune-ups, but in Dr. Noel's case, it worked really well.
Yeah, I have always recommended to my patients since, you started treating me for that. I'm like, you gotta go to the Siloam Center. Like he will fix your allergies, because that's something that's been my whole life. I used to get the shots from when I was 7 years old till the time I turned 18. This is the first season since you've treated me, like the first new season. The allergy counts are really high. The tree counts are really high. And I'm fine. And I was just like, could it be? That's pretty cool.
That is cool. That is cool. So these are just some things that you can be doing for allergies. And when we get started up again in a couple of weeks, we can be doing the NAT for you. In fact, next week, what we'll probably do is we'll go through a protocol of going through, showing them how I would treat you for the allergies.
Yeah.
And the neat thing is you can treat using NAT for allergies, you can treat for bacterial infections, you can treat for viral infections, you can treat for food sensitivities.
Mhm.
And with babies, it works particularly well. You get a baby who, I had a patient about 2 years ago. She was 9 months old. When she was 3 months old, she ended up with a cough, a viral infection, and the sinus presentation and everything else went away, but the cough persisted. And for the next 6 months, every night, this kiddo would be up coughing all night.
Wow.
Her mama brought her in. I treated the baby using the NAT. How do you do that, you ask? Well, you'll have to watch next week. How's that for a cliffhanger? But the baby, one treatment, and the baby was sleeping through the night without any coughing. So does it work? Yes. Does it make sense? To my brain, it makes perfect sense because I understand some of the basics of the physics and
The science
understand the
behind it.
basics behind the physiology. But when you're just coming to it, and you're coming to it from a brain that doesn't necessarily understand that relationship and how your cells can be picking up on some of these things, I can see how it would be a stretch and hard to believe. But it works. So if nothing else, become a pragmatist and say, hey, it works. So, because last week was such a smash hit with the moving around the office, we were going to do a show today where we discussed
Core workout.
core workout. Number one, why core strength is so important.
Mm-hmm.
And Dr. Noel's going to show you some things that you can be doing, and then I'm going to show you some things you can be doing.
Mm-hmm.
Number one, first and foremost, Doc, tell them why a strong core is so important.
Strong core is important because almost everybody that comes to me, if they have some kind of a lower back pain, they have a weak core. And that's very easy to have a weak core because if you do not stay on it with strengthening it, you will lose it. Don't use it, you lose it. So right now, a lot of people, they're not exercising. Gyms are closed. Some of you are doing, at-home workouts, getting, normalcy into your life. But the ones that aren't, you're starting to tell by now because it's been about a month. And then the low back starts hurting if you're sitting on the couch, not doing what you're supposed to. So I'll show you on Slim here what muscles are affected, and then we'll show you some little exercises to do at home.
So let's bring this over here so that they can hear.
All right. Are we in shot?
We are.
Perfect. Okay. So lower cross syndrome, I'm going to go over today. That has to do with the weak core. So if you look at Slim on a sideways view here, lower cross syndrome is when you have an imbalance in the lower half of the body. You'll have the weak core or abs, you'll have weak glutes, and then in reverse, you'll have the tight low back and the tight hip flexors or the psoas muscle. So then, your pelvis gets tilted a little bit, your back's tightening up, you're not sitting quite right. You come in to see me or Mo, and you're in pain, you're like, fix me. Well, you got to do some work too on your own besides just coming in to see us, because we're not just you're better, you don't have to do anything. It's healing, it's progress. So that's what lower cross syndrome is. At some point, I'll tell you what upper cross syndrome is too, but we're going to focus in on that with the weak core muscles. So should I get into right away some exercises that they can do at home?
Sure.
With that? Okay. So I have 5, and hopefully I'll remember them all without having to look at my sheet. But most of them are all on the floor. So to start, I'm sure everybody's, done core workouts before, probably crunches. That was fine. 2 years ago, people were like, yeah, crunches are awesome. It's better to do a plank than it is to put your spine through that motion over and over again if you already have some pain going on. So I'm just going to do a standard plank.
Can you go into a little bit more detail why that plank is going to be safer for your body than the crunches?
Yep. So, even if you think about it, if you're doing a crunch over and over, you're going through, you're compressing the spine. These lower discs are supposed to be open like this. Now think if they're already inflamed, you're pushing them down every time you go through that crunch. You're getting your lower back tighter, bringing yourself in. It's already hurting. You're not going to want to do a lot of them. When you do a regular standard plank, you're holding that neutral position. You're not putting the discs at risk there for injury. You're just holding it. You're concentrating just on the core. So I remember doing them when I was high school and grade school, and I could tell because I have a curve in my lower back, and every time you go through it, you kind of get a zing. Planks, you won't get that. You're not throwing that into the mix here. So does that explain it pretty good, Mo?
Mm-hmm.
Okay, perfect. So I'll show you just a standard normal plank. I try to strive for a minute. That you might think that doesn't sound like a lot, but if you're not used to doing it, it'll be enough. So you'll get yourself on the floor, carpet preferably, or if you got like a yoga mat. If you're in really bad shape, you can do it on your mattress if you're flat. So bring yourself down to the floor, get on your forearms here like this, and then you get yourself up just off the ground. You want your back to be flat and that you're forward like this. You don't want to be like this, that you're up in the air or way dip down. You're just trying to be straight up and flat. And you hold it for as long as you can. So try not to hold your breath. Just go straight like that. So that's one plank you can do. Another plank, if you want to do more of the sides of the core, come onto your side like this. Now your elbows down. First, you can just do it at your knees. And if that one gets too easy for you, and this is the same thing, you're trying to hold it for about a minute, you might need to start on the knees. If you get a little bit further, you can even take it lower. You can see my balance is a little off too with that. It's all part of it. bring yourself up like that. You get a little bit deeper into the side. So those are two different planks that you can do. One to hit the front of the core and the other one to hit the sides. You do it on both sides if you do the side plank. So those are the first two. Another one you can do would be, I'll do all the face down ones first. You can do the bird dog, which if any of you have ever gone hunting, you see that the dog will point at the bird where it is when you're flushing it out. This is kind of the same thing. So first you'll start, hands and knees.
Well, first you have to determine, are you a Labrador or a hound or a golden retriever?
I'll go for a hound. They're
Okay.
pretty cute. So you'll pick either side, which one you start on. Get your arm out. Then you want to get your opposite leg up like that. So keep pretty straight. So go like that. You're doing a cross pull. It's good for your core. You'll feel it in the lower core especially. And then you bring it back in. And you do the opposite. You can hold it for like 10 seconds or you can keep going through it. But it's working a cross section of that core instead of just the straight core like before. So, and then let's see, we'll do dead bug. What's my other one? I had 5 of them. Oh yeah, diaphragmatic breathing. That's what it was. Okay. So I'm going to show you dead bug now. So we got all the fun names. Bird dog, dead bug. So for this one, you think of like a dead beetle on the ground. They kick their legs up. This one's going to be the same thing. You want to put your arms up, your knees up, and then the hard part comes in because this is pretty simple at this point. You lower your leg down slowly, and then you bring it back up. And the next one. So even if your back really hurts and you don't want to get up on your hands and knees, you usually can do this one. So that is dead bug. And then while I'm here, I'll show you some of the diaphragmatic breathing. So a lot of us, we kind of talked about that fight or flight response, that you have the fast breathing, and we'll kind of go into that next week too. You're not always using your diaphragm all the way. So the diaphragm sits right here, and it's actually a big muscle. When you breathe, it pulls down, and then when you let go of that air, it comes back in and relaxes. So if you sit, you put one hand on your chest, one hand on your stomach, and just breathe normally how you normally do. And then do like 3 breaths and just pay attention where you feel the movement, which hand. So now you can ask yourself, did you feel the motion in the hand up by your chest and your throat? Or did you feel the motion more down by your stomach? If you felt the motion more up top, that's actually called accessory breathing. You're using the muscles of your neck, and you're using your rib cage to force it. And a lot of us do that. That's not what you want to be doing. That's more of a panicky kind of breathing where you're doing the shallow breaths that are quick. Diaphragmatic breathing actually comes from the belly. Just like I said, that diaphragm extends and comes back when it relaxes. So you should feel your stomach move up and down more than your chest. So now I want you to breathe and focus on breathing that your stomach moves, but it doesn't up by your chest and your ribs. Some people it'll be really easy. Other people that's actually pretty difficult because if you're not used to using your diaphragm, it's almost like, I don't know how to breathe any other way. But if you work with that, it's going to help you get better, deeper breaths in than the shallow ones. And it's going to help relax you. It's going to help work your core a little bit better than if you're using all the muscles of your chest. So that's another good one too. Because I've also had other patients come in if they've had some rib pains through there. They're tight and they're using all this and they're not really breathing how they're supposed to. So that's how that plays in with the abs. So
It's also important because if you are doing your very deep breathing like this, you're going to be turning over the air that's in the bottom of your lungs. If you're doing real shallow breathing, you're not going to be turning that air over, and it's going to be sticking there, and anything that you've breathed in, virally or bacterially, is going to stay in there and cause infection.
That's why you want the deeper breathing. Allergies too, it's triggering fight or flight. So the more you have the shallow breathing, that's why people do have it too when you have an allergy attack, it kind of constricts the airway. The body just wants to try to get air in quick. That's kind of that repetitive cycle that's throwing you deeper into that allergic state. So those are a few exercises that you can do for your core that you don't need anything at home for. Just make sure you have a soft enough surface that you're not going to hurt your knees by being on it or your back. And if you have any questions, you can let me know, and I can show you how to do any modifications based on what you have going on. Because some people do have, knee replacement, hip replacement, different things like that. But yeah, those are some of my exercises. What do you got, Mo? Do you want me to demo it, or do you want to show them?
I can do it. You can man the camera.
Of course.
So, Slim, I'm going to put you over here. Let me fix your jaw. When I took my first judo class, we did nothing but work on something called break falls, which is learning how to fall down and then getting back up in a very specific manner. And after an hour of falling down and then getting up in this specific manner, my abs were wrecked. And what I found was when I can take a patient who is got a very weak core, and I can get them to just practice laying down, because most people don't have a nice thick mat that they can practice falling. However, for a geriatric patient, it's very important for you to learn how to fall properly. So it would be good of you to get yourself into a place where there is a padded floor that you can practice learning how to do break falls. And we can go over that at a later video. Reason being is, if you learn to fall properly, you're going to learn to fall without hurting yourself. But we're going to focus on more today on how you get up from having been down on the floor. And so for my geriatric patients, I will suggest that you do 5 to 10 of these a day. Just practice getting up, and it's going to start tightening your core. So you want to get to the ground in however you can. And what you can do is you extend your right leg out. Your left leg is planted on the ground. And as good old Marty Conrad, my buddy, used to say, you're kind of in your chilling out position. Okay? Like you're at the beach chilling out. Well, now your right hand plants on the floor and you lift yourself up. And this might be a little complicated, but you lift yourself up and you come up onto your hand and your foot and you bring your leg back and you stand up. And what you'll find is you're building your muscle memory in your body on how to stand up, yes, but you're reconnecting your brain to these slow twitch muscles fibers, which is only going to happen if you're doing it kind of slowish, as in oven pertaining to slow. So you don't want to just pop right up. And you do 2 on one side, and then you do 2 on the other. Lift yourself up, come back, and then stand up. And what you'll find is you do that 5, 10, 20 times to where you start feeling the discomfort, that burn. And what you're going to find is it's not just focusing on these muscles here, but it's going to be focusing on those core muscles all the way around. If you're doing an exercise that only focuses on these guys right here to give you washboard abs, it's not going to do you much good because it's not strengthening your core.
You mean that whole girdle, right?
You want everything in this area, including back here, but you want it balanced. And so doing the right exercises to accomplish the strengthening is going to go a long way towards not just strengthening, but stabilizing. And it's more important to have a stable core than to have the washboard abs. You want the stability, because the stability is going to maintain the tensegrity of your body so that you can stand for extended periods of time, or if you have to be in a car, you can sit for extended periods of time without having the pain.
I want to ask you something too, Mo. Is it possible for a muscle like the low back you said here, can it be tight but weak?
Mm-hmm. Oh yeah. Think of,
Because we got a lot of patients here like, well, it's tight. It's got to be strong then, right?
think in terms of maybe this experience was unique to me, but when I was a kid, we had the old brown ropes hanging from a tree, and they have the tire on the bottom, and you'd go running out there and you'd swing on the tire swing and you'd go out over a ditch and you'd go woo, and it was so much fun. In the first couple years, the rope was good and taut and strong, but eventually, after being out in the elements, not being taken care of, just like these muscles in our body, that rope was real tight because it had the weight of the tire and gravity, but it wasn't strong. And so then you get this goofy kid running, grabbing the swing, catching it, and the swing's traveling this way and the rope's going back that way. And you go in the ditch and you have to explain it to your mother why you ruined your clothes. But that's what happens in our body. Those muscles, they can be tight, but it doesn't mean that they're strong. They can have hardness and be hard as a rock, but it doesn't mean that they're doing any earthly good to help support your body. It could just be that there's an inflammatory response causing a spasm. So if we can get rid of that spasm and get these muscles to relax, which acupuncture is phenomenal for taking care of that within just a couple needles. Chiropractic adjustment, the right chiropractic adjustment, whether it's acupuncture, chiropractor, dentist, eye doctor, any person in a white coat that is interacting with you and your body, it better be the right one for you. Because if you get the wrong one for you, they're going to miss things. They're probably going to mistreat. So now we have misdiagnosis, mistreatment. They might get lazy. They might just be, this is what I do. And so I'm going to stay in this little narrow trough of how I practice, as opposed to, hey, we've gone a half of a mile down this road and we haven't seen any change in you. Let's try something different. The reason Dr. Noel is in this clinic is because she's trying to work herself out of a job. Every practitioner at the Siloam Center has always had to have that mindset. We want you better. We don't want to see you once a week for the rest of your life. And I've told my patients, and some of you that are watching this now will say, yeah, I remember when he told me that. If I tell you, come in once a week for the rest of your life, fire me. It shouldn't be. We can either help you or we can't. And if we can't fix you, we'll tell you what we can do to help maintain you. So it's important that you have the right practitioner. But as far as core stability, if planks aren't your thing, if fancy work arts aren't your thing, make sure when you lay on the ground, make sure you're getting up correctly. Okay? Make sure that you do that a few times a day. Make sure when you're doing your push-ups that you're doing them with the correct form. Make sure that these movements aren't necessarily super fast, because, yeah, your fast twitch muscles learn very quickly, but we want the slow twitch muscles to get involved, which is why in the martial arts world, you've got these, you see the movies of these guys doing their fancy movements, their kata, and it's very slow. Why? Because they're trying to engage those slow twitch muscles so that they have both the fast twitch and the slow twitch response, and it's motor memory. You don't even have to think about it at that point. So then there's, if you have one of those neat, what are they called? Those big balls.
So those exercise balls?
Those exercise balls. They say just sitting on them helps to stabilize the core, and it does to a degree. But one of the things that I love to do, and I owe my friend David Martin great kudos for showing me this, is there is an exercise where you lay on the ball like so, and you dip your leg one under the other, like so.
Okay.
And you just continue to rotate your body on that ball. And what that's going to do is, yes, it's going to work on your core, but it's also going to stretch and open your hip muscles. Your hip flexors, those hips are going to become more stable. And
especially when falling, like you said, you need strong hips, you need strong glutes. So
you need strong muscles and you need flexible muscles. If all of those muscles are tightened down, it's going to break. When you're dealing with metallurgy, if the metal is really brittle, it's going to be really hard, but it's brittle, it's going to break. You need some malleability in there. You need some flexibility for that metal so that it can absorb the impacts without shattering. Think of glass. Glass is very, very brittle. It's very hard, but it's easy to shatter it. You don't want your muscles to be so hard and brittle. You want them to have some flexibility. And another example is, how flexible are your muscles? If your muscles are not flexible, then neither is your cardiovascular system. And if your cardiovascular system is tight and inflamed, then you're going to have some cardiovascular disease, which can be reversed. Diet, exercise, appropriate supplements and herbs, treatment. We can take care of all of that stuff. But how are you going to know? One of the things, very basic tests, is, can you touch your toes? If a person has a hard time touching their toes, then they're probably having some vascular problems. Their vascular system probably isn't that flexible either. And so make sure that you're working on these things, because just like Dr. Noel said, you either use it or you lose it. Sort of like brain function. You use it or you lose it. I love seeing older folks working on their Sudoku, their crosswords, doing their little brain exercises. But even just as importantly, they need to be moving their bodies. Now, they can't necessarily be out there, wrestling alligators, which, if you're seeing Dr. Noel for a herniated disc, lay off the alligator wrestling. You're only going to exacerbate the problem. Let her get you well, and then go wrestle the alligators. Let's go back to the. I'm getting goofy.
okay.
That's what the world needs.
If you bring me an alligator purse, though, don't even worry about having to pay for treatments. We can work something out.
So what you're saying is you can be bribed.
Sometimes.
Okay. So we are now at that point in our show where we've got about 15 minutes for questions, and we have John who says, I have a question regarding knee and low back pain. Is there a possibility that orthotics for inside your shoes can help? Doc?
If you get the right ones. Say if you just go to Walmart and you step on the Dr. Scholl's machine,
You don't like that Dr. Scholl's machine?
I think I can do better. That's all. So
Here's why she can do better. She knows your body. She's trained to look at your body and how your structure is set up. And a good practitioner can stand behind you and say, oh, this person's arch is dropped 1/8 of an inch. And if we shim that just there in that arch a little bit, hey, look, that left shoulder dropped. She knows how to do that. She knows what to look for.
you start from the ground up because a lot of us, the inside of our feet are going down. A lot of the popular shoes right now don't have arch support for most of us until we get to the point where we learn.
And a kiosk at Walmart isn't going to catch
No,
that.
no.
They have it's designed to measure certain things, and
It's generic.
it's generic. It's cookie cutter. It's cookbooking it, and you can't afford that when you're dealing with your feet.
No. So what I offer, I have orthotics that I actually hand mold for you. So you can come in, I have the base model. We do the assessment with you, and then we see, can we add a little bit more arch than it initially has to it? Where do we need to add it? Because there's different arches in the foot, and that's another topic that we can go into at some point. But if you don't have a good solid base and you're already dipping, it's going to go up the chain. So like John had mentioned, he's like, can it affect knees? Definitely. That's the next joint that's up. If you're not having level feet here and they're dipping in, your knees are going to dip in. The next is going to be the hips and the back. That's going to compensate. And then you keep moving up the chain. That's why a lot of times when people do have low back pain or knee pain, how are your shoes? Are your shoes worn out that you look at the bottoms of them and they're like this or like this? For one, get decent shoes.
Yes.
And two, let's get you leveled out to give you a fighting chance.
When you are building a house, you can build an incredibly beautiful structure, but unless it's on a decent foundation, that house is going to start settling weird, and it's going to break.
You're going to start noticing things in your house. You're going to notice the big cracks, or all of a sudden the beam doesn't seem quite straight anymore.
If our bodies are used to walking around on shoes, and in our society, it is. In the old days, yeah, you could get away with barefoot, or you could get away with moccasins because that's how you always were. Your body was used to that. But we're not that way anymore. And so we're walking on these pillows, which is very nice and comfortable. However, we're buying the cheapest possible shoes that we can. They break apart. They don't hold up. And that support that we need, that our bodies have learned to depend upon, ain't there anymore. And that throws the tensegrity of the body off. There's that word tensegrity again. What's tensegrity? Tensegrity has to do with, it describes the tension and the pulling, the torsion strength of how all of your structures in your muscles in your body work together. The fascia, the bone, the muscle, all of this working together, pulling, compressing, twisting, how it all holds together. And if you have a spider web, if you poke and pull on one thread, it's going to pull everything in that spider web. If your feet are not working properly, if there's a bone that's collapsed a little bit, that throws the rest of the structure out, not just in the foot and the leg, but it can be traced all the way up your body, clean into the back of the head.
Yeah.
You can feel it into the mastoids when you're palpating on your patient. So finding a practitioner that can identify this stuff is essential.
And the reason it does go all the way up to the head is because your eyes want to remain level with the horizon. So our body is amazing and so smart that everything else will tilt to make it look straight normal to us.
Mhm.
And then you have to come see us to put you back together.
Excellent question.
Right. Thank you, John.
So if there's any other questions, or if you end up with a question during the week, go ahead and email it in to us, info@siloamcenter.com, or even put your questions in the comments section down below, and we'll try to address those next week. If there's no other questions at this point, we have to say adieu. Is that how you say it? I never took French class.
I didn't either.
We're going to say sayonara. How's that? So have a great week. Shalom and be well.
Bye, guys.